this is the third part of our video where we integrate our modules and blocks into our discussion. The fourth part is how we are going to approach these modules and blocks by using resources, or rather, which resources should we use? Well, I'll divide these resources into two major components: learning oriented resources and exam oriented resources. Well, here I want you to understand this, that some people just follow learning oriented resources and they then fall down in exams. They study thick books, extensive resources, study very much, and put a lot of hours in their studies, but they cannot produce the results because they have neglected this exam oriented part. But some people, just you'll see that they don't go to the college all year and they just study from short books at the end of the year and they score pretty much to pass the exam. But but the problem here is that they lag behind in learning. That this last time learning will fade away. But what you have studied throughout the year, you have read, reviewed, and recalled things. They'll stay longer. So how human memory works and how learning works, that is another consideration. But just trust me for the time being that you need to balance both these. You don't Both of these are important. Exam is important and learning is also important, because you are in a professional degree. You want to be called a doctor with a degree, not a person, not another person with a degree. So you need to consider both things equally: learning oriented and exam oriented. Well, just going to the resources, cutting it short. As far as learning oriented resources are concerned, number one, anatomy. For anatomy, learning oriented resources, of course, number one is books. The gold standard books are Gray's Anatomy and Snell's Clinical Anatomy. Gray's Anatomy is more extensive. Snell's Clinical Anatomy is, it can be used for both exam oriented learning and learning oriented study, because it is concise and comprehensive at the same time. So this is mostly used, and I used it in my first year, though I integrated Gray's Anatomy also by the end of first year and in second year. But these are the main resources used by the students. Other students can also use PD Churasia or Gelas. There are many options, but these are the major learning oriented resources in books which are used in first year MBBS as far as gross anatomy is concerned. Well, after gross anatomy, then there is yes, with gross anatomy you have also to use an atlas. Netter's atlas is mostly used. That is actually a lot of anatomical pictures in detail of the human body. And thirdly, you have to also supplement your gross anatomy with your anatomy museum, because now dissections are very uncommon, so you will have to depend mostly on models, but they are very important. Anatomy is to be retained, and by the end of the year you will know a lot of you will know it on your fingertips, but initially you will just be scared of the subject anatomy. But so you will have to supplement it with the models in your museum and group discussions. And I'll also recommend a learning oriented resource, that is Auckland Video Anatomy series, that is dissection series actually of the anatomy. So this is about gross anatomy learning oriented study. As far as physiology learning oriented study is concerned, Guyton or Gnong are the go-to books. There are other books also, but these are the primary books to go to for learning oriented study. Then after physiology, there is biochemistry. For biochemistry, there are a lot of options for learning oriented study. Harper's Illustrated Biochemistry is the go-to book. Then Lippincott Biochemistry is the go-to book. But we mostly study Indian books, that is Pankaj or Satya. I actually studied Satya in my first year of MBBS, then Lippincott in second year of MBBS, because most of the biochemistry chunk, that is metabolism, is in second year of MBBS. So in first year of MBBS, you just need basics of biochemistry to be integrated into your modules. So you can choose any one of the learning oriented books. One primary book is essential. So after studying, selecting your books for these subjects, we go to the other two branches of anatomy, that is embryology. For embryology, there is Keith Elmore, Arya Last, and Langman embryology. I actually use Langman embryology, and that is a gold standard. For histology, the two books that are go-to is DeFiore's Atlas, and there is another book by a Pakistani author that is like Hussain. So both of these can be used in conjunction or individually. So De Fiore's is actually more picture-oriented book. So and the other one is mostly text-oriented book, but anyone can be used. I actually use De Fiore's. So this is for the books. As far as online learning-oriented resource is concerned, uh, I would tell you that there are not much learning oriented resources as far as online studies is concerned, except for Dr. Najib lectures, which are more detailed and more learning oriented. I don't know of any learning oriented lectures which are available online. There are many lectures, but they are mostly exam oriented, which we'll discuss in our second section of the resources. Well, so this was about the learning oriented section and the resources in books. So firstly, books, which I have told you, learning oriented. Second, your classroom, your teachers, your colleagues, discussions, very important. I cannot emphasize it more in this video because we'll fall short of time. And thirdly, because now this is modular system, I recommend you to start going to your wards and hospitals from first year on your own. See, no one will tell you these things because I have told you in my first video that our modular system is still very raw. It is not as refined as it is in other international countries. So we need to polish it ourselves. So one of the components is that you have to have early clinical exposure. That is the essence of modular system. But in our system, that is very rare that you will go to hospital before third year. So I recommend you go on your own with the friends, and you will find teachers and mentors and seniors who will be there to help you out. And for example, if you are in blood module, you have studied anemia, go to your hospital and see a patient of anemia, how he presents, how he looks, and you will just come to understand that clinic or hospital is just another horizon out of the books. So that is very important. That also comes under learning oriented study. So this was all about resources of learning oriented study. Now we go into the resources of exam oriented study. Okay. Now exam oriented study mostly constitutes of short books, your notes, and online resources. Right? As far as short books are concerned, I didn't use any short book for anatomy and I don't know of any. But as far as online resources concerned, many online resources are there for anatomy. You can search them for yourselves. I didn't use much, but CanHub is most talked of resource as far as anatomy is concerned. And secondly, for physiology, the short books are Firdos Hussain, Costanzo. You can use any one of these short books for your review, and there might be other, but I know of these. And then number third is biochemistry. For biochemistry, also I don't know of any such short resources, but yes, online for physiology and biochemistry you can consult for exam review. You can consult Kaplan lectures, you can consult Boards and Beyond lectures, you can consult Pakistani lectures on YouTube by channels, different channels, like there was one Selfless Medicos, and you can also use other lecture series by Indian platforms like Marrow or PrepLadder. So there are many online resources which you need to choose yourself, because I cannot at this moment recommend you, because I don't know what type of person is watching this video, that which lectures to watch and which not to. So you have to choose what fits best to your taste. But so yeah, this is about the online resources and exam oriented resources. And the third resource I said about exam oriented is your own notes. This I prefer most, because human memory works in a different way. You will study in second year MBBS how memory is formed. Notes writing is very important. Writing bridges your subconscious mind with your conscious mind. So if you are studying whole year and you are making your notes yourself, and by the end of the year you don't have to review a short book or online review lectures, you have your own compact notes and you just review them for your exams. That is the best way to approach exam oriented learning for this discussion at least. Well, that is our discussion about resources. Number 5, the fifth domain I want to discuss is that how to now approach this exam oriented learning and this learning oriented study and exam oriented study together. Well, I'll just give you an example. I Most of things I have talked about in resources, but I'll just with an example I'll tell you how I integrated exam oriented study with learning oriented study. By giving you an example of one subject, that is physiology. Now, physiology, I use textbook guidance. Guidance is very thick textbook, and you start from first page and you go to the end, and you come to the conclusion that you don't know anything, the author doesn't know anything, and many memes are there on physiology regarding this. But it is very important to study from big books because your horizon gets broadened. So physiology, once you study you don't remember, but of course you have to study it so that your horizon gets broadened and you are more learning oriented. So how to retain it? For that purpose I used the blank page before every chapter of Titan physiology to make my own notes, concise notes. I read the chapter, then I sat back and I reviewed whatever I had learned, and then I just compiled it into and uh, just compact. I just compiled it into compact notes of my own into one single page, so one chapter on one page. So it takes time. It takes time. It's not easy to combine learning oriented study with exam oriented study. But this time, this half hour you're spending at this moment in making your own notes will save a lot of hours at the end of the day. So mind these words. Secondly, I also want you to understand that many of your seniors might tell you that now this modern era there is no need of books to be studied, but I'm telling you that this is very important. You are in first year of MBBS, you develop this habit of studying books. It will be difficult at first, but once you start developing habit, one page might take half an hour, but then eventually it will take 20 minutes, then 10 minutes. Initially it will be hard, but then you will get used to it, and once you set the tempo, then there is nothing that can stop you. And this is very important to integrate learning oriented study and exam oriented study. There are many students who fall behind just because they can't know it, and I'm very thankful to my mentor who told me this very early enough, and it is his light which I'm spreading forward. So this is very important. You have to integrate learning oriented study with exam oriented study. I've told you with an example of my own. You can choose your own combination of learning oriented resources and exam oriented resources and just set a schedule for yourself. Well, uh, with this, at the end, at the end of the year, of course, you have done all of the learning. Now it is exam time. You will get more than 40 days of preps before exams, so you should have your syllabus at least finished once during the session. And when you will go to exam, you will be knowing most of the things. You will have your exam oriented material ready. You will have to do just reading, reviewing, and recalling. Reading, you have done most of it. You have to do reviewing of your content, and you will have to do recalling. And recall, by recalling I mean active recalling, and we'll talk about active recalling in some other video. But you will have to also integrate your learning with practice resources, that is past papers and questions, and there are a lot of question banks where you can use. And those students who are wanting to sit in international exams like USMLE or PLAB, they need to plan very early onwards in your first year of MBBS, so that you can choose your resources accordingly, which will not only uh, help you in achieving your first year of MBBS but also your exams at large later. So I think that's a lot for today. So just summarizing the content, we talked in four domains. Number one, five general considerations. Number two, the four subjects of first year MBBS. Number three, the three blocks of first year MBBS. Number four, uh, the resources which need to be used, learning oriented resources and exam oriented resources. And number five is the integration of those resources in a way that you have a balanced learning oriented and exam oriented study that doesn't just make you ace your exams but make you a good doctor in future. And at the end, I've just discussed a little about exam and international students who want to sit for international exams. So that's it for first year MBBS general guidelines. If you want us to make videos on specific blocks, detailed videos you want us to make, just tell us in comments so that we can put our effort into making detailed videos block wise. Or you can also approach us via our Instagram or uh, Facebook pages, and our media manager will inshallah respond to you accordingly. Uh, for more such videos and more healthy content, uh, just subscribe our channel and push the bell icon so that you don't miss out on our upcoming videos. And thank you very much for today.